nationwide coverage. Are they enough? No, it's not enough.
How many ambulances do we have as a country?
We are talking about over
108, but functional we have about 70 who are really plying the streets and
What happened to the rest? During Ebola, how many ambulances did we get? And during COVID, how many did we get? That now the mathematics is leading us to have 108 with just about 70-something functional.
Well, you see, the management of ambulance system is a very expensive. It's a capital expensive.
No, now the question is not about the management. It's to get the figures right. How many ambulances did we get during Ebola and during COVID?
I won't give you exact figures during Ebola and COVID, but I'll tell you at the moment we have about 108 plying routes. And
we surely should have more than 108.
Over the years,
what happened to the rest of the ambulances?
At that time, whatever amounts we had at that time, it's been over 10 years since Ebola.
Since that time.
Yeah. So there are breakdowns, wear and tear on those ambulances. Some of them cannot really cover long distances. Some of them can be used within, limited radius. So, over the years, we really lost a lot of those ambulances. Replacement, like I said, is capital intensive. But we are making do with what we have. We keep planning for what is available. But I would say we still have a national coverage. Chiefdoms, every chiefdom is actually entitled to an ambulance. It may not exactly be the case because some of them, are not effective now. But the National Ambulance Service is actually working on those ones. They are doing repairs, constantly doing repairs, but it requires a lot of funding to really keep that number of ambulance required for national coverage.
If I may add, can I please?
Yes.
There has been a tremendous improvement in the ambulance services. I know the perception you're having is the perception of somewhere back last year, where the ambulance services had a series of challenges. So what we did as a ministry, we had to restructure the entire governance system. The leaders who were in charge of the ambulance services were put on hold. So we have a new team now managing the ambulance services, and the data we are getting are encouraging. We used to have referrals for over a month, close to 500. Now they are clocking close to 4,000 a month. Maybe you're not hearing the sirens, but the sirens are moving around, and the data we are getting is telling us that. And we have a robust ICT system. The calls are coming in now and responded to. The the response time has really shortened to 15 minutes from when you call an ambulance within the western area. If you're in the provinces, 30 minutes because of the poor road network. The ambulances we supplied last year, by the end of the year, about 12 or 15 new ambulances to augment the fleet of dilapidated ambulances which were within the system. Routine maintenance and fuel management and monitoring systems are really now upscaled to a level where we can really track how much fuel is being utilized per kilometer of distance covered by these ambulances. So it's not perfect, but there's work in progress.
Who are the people entitled to benefit from the services of the ambulance?
Pregnant women. It's a high priority, pregnant women who have to deliver in a hospital to reduce maternal mortality, prevent delays. Road traffic accident people can call if there is an accident along the highway. Children who have issues in hospitals can be referred, and we extend to acute emergencies so that at least somebody can be helped if you call the ambulance system.
Beyond just helping patients, picking up corpse, is that also part of the services of the ambulance?
No, it's not.
I asked you to get this clarity on it because the ambulance services, when you talk to people in the streets, it's really difficult to come across people who would tell you, oh, I called the ambulance and they got there. We enjoyed the facility, we enjoyed the service. So it makes it really difficult for a population of 8.6 something million people to be able to identify people who have benefited from the ambulance services. But what you get mostly is people will tell you, oh, I made a phone call, they're saying there's no fuel in the ambulance. Who manages the fuel system for the ambulances? To a point that people who call are asked to provide fuel for the ambulance. Is that the official format?
No, it's correct. It's wrong. That is what I'm saying. Last year we had these issues. So there were issues around the management of all of this. So we had to put those people aside. Now we have a new structure in place. I will assure you that if you call...
When you say put them aside, how?
They are suspended from their duties.
It comes back to what I was asking. Right. Does the punishment match the crime?
No. The punishment will not stop at suspension, but the first action is to suspend whilst they're being investigated, right? And put in a new team to manage. If you call the ambulance system and somebody asks you for fuel, please let us know. This is what we are saying to the public. We cannot strictly monitor this out because we are not the service beneficiaries at all time. Our system is in place and we are getting full assurance from our staff running the system that there is fuel available for every ambulance. So if somebody asks you to pay for fuel,
what's the number for the ambulance system?
I think I have to check again. It's, I think, 030 400 300.
Please check that, because as we sit, we'd need to confirm how effective that system is. As you've just said, there have been some improvements. So let's clarify and cross-check the impact of the improvements you've spoken about. So let's get the number and try calling the ambulance system this morning to see whether or not it works. What's the number again?
I'm finding out. We'll give you.
Okay. Whilst he's looking for that number, these are some of the very serious issues. The gap between the services provided for the people of Sierra Leone by the ministry to what they actually benefit from. That gap is where the misconduct, the corruption, and all the wrong things happen. These people that were running the ambulance services who have now been tossed aside, what are they being investigated for?
We had a series of reports against them, particularly for poor services. We were hearing from the public that it was taking forever for services to be delivered. A call is made and it takes forever. We have had some of the allegations you just talked about, like, oh, there's no fuel, oh, there's no tire, oh, there's, you know, and we're tired of excuses. We think that people are given responsibilities for them to deliver on those responsibilities. You preempt problems and then you solve them ahead of time. This is an emergency system. We are not going to tolerate excuses. So after getting all of those reports, we decided to put them aside because we want a robust system. And frankly, what we are now experiencing, like what Dr. Kabba is saying, shortening of the response time, we're celebrating that.
Well, even the response time in the studio right now to get the ambulance number is longer than I expected.
Well, yeah. There are three numbers, and we used to use the 117, but now it's a health emergency number. So we have the 075 300 400.
Okay, so what is the actual procedure officially? How is it supposed to work? Let's continue that. I'm making the call already.
You make a call. You call one of these numbers.
Wait.
Hello, good morning. Hello?
Yeah, good morning.
Good morning. How you do? We get patients from Pademba Road where we need for Kergo Hospital. Wanna go able to send ambulance for them?
Pademba Road?
Yes.
Correctional center?
No, wanna go able to send ambulance for care that patients they go hospital?
Yeah, which hospital can go?
Well, we not gonna know anyone from the public hospital then, but
No, like I say, like una specific hospital, police hospital, anytime when I refer a patient.
Okay, it can be Connaught, it can be 34 hospital, in no matter Uswan Pandem.
Okay,
What's in the procedure for law get the ambulance?
The ambulance, where you give the information about the patient, they make a call, refer coordinator, to tell them about the patient, then if it's first day, he will tell you back. Yeah,
Source information you need.
The name of the patient's name.
Then what thing you go do after that day?
They make a call the ambulance. The ambulance is available right now. You need the patient's name, yeah?
How long it go take on for make on able car with the ambulance?
The ambulance next time, just give me the information first, please.
What's in your name?
What to say?
What's your name?
What to say?
Okay. Thank you for we answer the call, yeah? This is a call from AYV. We be just one confirm say the system they work.
Okay. Thank you very much.
So this tells us that yes, the system works this morning.
This morning, it's not only this morning.
It's always working.
Well, it should be every day.
Yeah.
Every day is a day on its own. It
Yes.
could work today and probably not work tomorrow. Not what we expect. We want it to work every day. So that's the angle I'm coming from to say the system works today. But we're talking about those people now put on investigation. So for fuel that they were asking people to pay for, that should constitute a criminal offense, shouldn't it?
I mean, if that was the accusation, then we take it case by case. Yes?
So amongst those being investigated, is there no such where anyone was asking anyone for fuel?
We are waiting for the report, and we'll go to the next level. But no stone is going to be left untouched.
Mm.
Let's talk about the maintenance of these ambulances, which is also a very serious challenge. Personally, with people's private vehicles, we know that our vehicles need maintenance. When it comes to public service work, public service vehicles, ambulances, it becomes a challenge with the maintenance. And if you are not doing periodic maintenance of those assets we have, then it's going to expire, so to put it, sooner than it was meant to be. Maintenance is what keeps your vehicle up and running. How often do you do maintenance on these vehicles, on the ambulances?
So it's for the same reason that we have a new management in place, with a different mindset to addressing these issues of maintenance, to addressing service delivery. I mean, the guys in place now know what to do, and they are up to the job. That's why you now have this shortened response time. Maintenance, I mean, every vehicle model has their own maintenance policy, maintenance requirements. So, but generally speaking, you're talking about 3 months. And for ambulances, which are almost every day on the road, it requires frequent reviews, frequent servicing. And I think that is happening. That's why we are able to maintain the current fleet in the state they are.
And just before we round off, so it was three strategies that the minister launched. We've briefly talked about 2 of them. There still should be one more of those strategies, costed national strategy for the elimination of cervical cancer we've dealt with already. We've dealt with the national hospital strategy for service delivery. Let's talk about the National Oral Health Strategy Plan. Oral health is, again, one of the areas that many people don't take too seriously. People really don't, for some people, it's that they don't even know much about oral health, talk less of paying attention to oral health. What difference would the strategy make?
Well, the strategic document, of course, has done a proper assessment of the situation we have in country to look at what is available first of all. That's the baseline. What do we have? And how do you build on it? So you look at the human resource, the equipment, the space, and the supplies needed to develop oral health. Over the years, this area has had its fair challenges, fair side of challenges, and we have very few dental surgeons in the country. So one of the key